Hi everyone, welcome to Dr. Kim's Radiology YouTube channel. And if you haven't done so already, please smash the like button and click to subscribe my channel. My goal is to help you to become a better radiographic diagnostician. So today I have a really interesting case to share with you. So what you're seeing here is a periapical radiograph of the maxillary patient's left lateral incisor. And you can clearly see tooth number 10 is missing its crown with endodontic filling material extending to the apex and with some perhaps sealer extending beyond the apex with periapical radiolucencies as indicated by this my mouse cursor. But that's not the point that I want to make here. There's a really unique finding on this periapical radiograph that if you pay really close attention to, you can pick it up. But it's a tough one. So, can you pick out where the interesting finding is? Well, as a matter of fact, I've already given you the title, and you probably know what it is. So, we're looking at a mesioden. There is a mesioden on this radiograph, but if you didn't know, try to look for it and just ask yourself, would you have been able to identify this mesioden if I didn't tell you from the title of this video? So now you know what I'm looking for. Where is it? Can you find it? Well, I'll give you another radiograph, another projection of this area. It might help you to determine. So let's go over to this side. And obviously, tooth number 9 is missing. But where is the mesioden? Right? It's tough one, okay? But you have to look really carefully to determine it. Let me go over to the next one more time because I think the other one is a little bit more telling. Okay. In order to answer the question, we have to identify some normal anatomic features. What you see here is this oblique radio-opaque line. And what is that? Well, hopefully if you are my student that you should know this from my lecture, but this represents a nasal aperture. Okay, so this is a nasal aperture. If you want to call this a floor of the nasal cavity, that's certainly acceptable. So here's the nasal aperture. But if you look really carefully, you see this kind of radio-opaque entity going up above the nasal aperture, right? And I'm just generalizing the approximate location of the tooth. Well, you might be asking, well, Dr. Kim, how could we have known that this is a mesioden? Because although you can see my outline, but this area doesn't look anything like a tooth, right? It looks like more of a normal bone. Yes, you can see this area is a little bit more opaque. Also, the fact that this is located above the nasal aperture, what does that mean? Is this sitting within the nasal cavity? Like, how do we make a sense out of this radiographic finding? Let's take a look at this again. Here we have nasal aperture, right? And here's the nasal septum. And just above the nasal aperture, there's this kind of amorphous radio opacity. Again, it's really hard to make out the full length of the tooth, right? Because as this area looks like, there's a normal trabecular pattern. And also keep in mind that there's a sharp vertical angulation when you take a periapical radiograph in the anterior maxilla. Therefore, you're seeing bone patterns even though this is above the nasal aperture. So how do we explain this? Like, how should we visualize three-dimensionally, right? The fact that it's above the nasal aperture, the fact that you don't see the full extent or the border of this mesioden. Well, I have a great news for you. I do have a cone beam CT scan of this area. Hence, I can improve the learning outcome from this video. So here's a scan of this patient. I've already put my crosshair on the tooth. let's see, which one should we look at? I think all three views are quite helpful in this case, but I'm gonna zoom in just a little bit. Well, let's bring it over here. Let me actually do that. Okay, so look, it's pretty clear that this is a mesioden, definitely a tooth, because of that very densely radiopaque area, which represents the enamel radiodensity. And you can see the dentinal or radiodensity that is consistent with the root, and perhaps even the pulpal structures in that area. But you also see that there's not a full outline of the tooth, right? There it is, and then you lose it, and a lot of that is now replaced by the trabecular bone. And also note that this is the floor of the nasal cavity that we saw previously, and that indeed it does extend up and slightly above the floor of the nasal cavity. So let's take a look at this in other planes. So how about we look at the sagittal view over here, and there's a mesioden. Interestingly, this tooth is inverted, right? The crown is pointing superiorly, and although most of its root is resorbed now, I presume this might have been its original outline of the root, something like that. But now it's mostly resorbed and replaced by the bone, and what you have is just a small portion of the crown that's at the level of the hard palate or floor of the nasal cavity. And let's look at that in the axial view. There you go. So here's the axial view. Again, all we really have is just a small portion of the enamel and perhaps a little bit of dentin, and that's about it. And that is the reason why it was so difficult to visualize on periapical radiograph, because it was superimposed with the floor of the nasal cavity or the nasal aperture along with normal trabecular bone. It was really hard to interpret, and if you didn't pay close attention, I'm sure that most of you actually would have missed it. But now with the help of cone beam CT, we know exactly where it is located, and the fact that it actually is inverted, right? That's really cool. It's cool that we can see it so clearly now. And this is the 3D rendering. So I've kind of played with the radio density, changing my threshold, so you can actually see that the enamel layer or the crown of that mesioden is actually showing on this 3D rendering view. Furthermore, I know that number was it 10? Yes, 10 was missing its crown with periapical radiolucency, and that can be seen here as well. So let me rotate my view so that we're looking at number 10, and there it is. It's missing its crown, and there's a clearly periapical radiolucency involving this tooth. Right? So there's a periapical radiolucency. There it is again, and also in the axial view you can see the periapical radiolucency that extends toward the palatal cortical outline rather than buccal. Again, this information is not something you could have extracted necessarily from single periapical radiograph, but again, the power of cone beam CT is clearly demonstrated in this example, giving you the complete anatomic information in all three planes. So anyway, if you learned something new, if you thought this was interesting, please hit the like button and be sure to subscribe. I'll continue to post 3 interesting cases every week so that you can continue to learn from me at no cost. Thank you very much, and I'll see you at the next video. Bye.